Hi everybody, I'm Dr. John Hayes and I'd like to welcome you to this week's episode of Beating Neuropathy TV. What we're going to do today is to talk about a key nutrient called vitamin B1 or thiamine. The reason that thiamine is particularly important to neuropathy patients is that we know that a deficiency of thiamine can cause many health problems. The classic disease that's caused by thiamine deficiency is something very severe called beriberi. Unfortunately, many people in our society, as a result of consuming overprocessed foods, are deficient in thiamine or vitamin B1, and this can lead to a whole host of health problems. Plus, there are other circumstances such as excess alcohol consumption that can also cause your body to deplete thiamine. This can lead to some critical health issues. Mild deficiencies will present as fatigue, perhaps some memory changes, and so on. More significant deficiencies of thiamine have been associated with some significant neurologic disorders. The best way to find out if you are deficient in thiamine is to have a blood test. But short of that, we do recommend dietary supplementation for most patients, and thiamine is a key nutrient, especially for neuropathy and pain patients. The reason for this is that thiamine is critical to help our bodies manufacture the molecules which help us produce energy and support nerve health. But you need to be aware that not all forms of thiamine or vitamin B1 are created equal. Some forms are much better than others, and some are more poor than others. There are a couple different forms of thiamine that we utilize in the neuropathy clinic. The first is thiamine hydrochloride. Thiamine hydrochloride is a great supplement. In fact, it's commonly used for patients who are recovering from neurologic illnesses. The problem with thiamine hydrochloride is it can be difficult to absorb in some patients, and it can cause some stomach upset. Another form of thiamine that we see touted regularly for patients with neuropathy is benfotiamine. Benfotiamine is touted as a water-soluble form of vitamin B1. That's not entirely true. Benfotiamine can pass through cells a little bit easier than thiamine hydrochloride, but there's an even better form. This better form of thiamine or vitamin B1 for neuropathy and pain patients is actually in the allithiamine component. Allithiamine is a naturally occurring form of vitamin B1 that is present in garlic. This is one of the reasons that crushed garlic is such a powerful nutrient to be added to food preparation on a regular basis. The best way to find out which form of thiamine you should be taking and how much you should be taking is to work with your health professional. The worst thing you can do is to guess at dosages. Also keep in mind that B vitamins should be taken together. The B vitamins tend to occur in different amounts in nature. Therefore, be very careful of supplements which show the same amount of vitamin B1, vitamin B2, vitamin B6, etc. That's not naturally occurring and probably not the most beneficial for yourself. For more information regarding the best up-to-date thiamine supplementation that we recommend, you can find out more at our main website, neuropathydr.com. Thanks for watching this week's episode, and we'll see you next week.